Something that's really important for us to remember, particularly when we're going through large life events. Somebody's gotten a diagnosis, we've gotten a diagnosis, somebody's near to death, whatever the situation is, any kind of transition, to be extremely kind to ourselves. We often forget when we're so busy taking care of somebody else or taking care of all the minutia and the details that happen when you get a diagnosis or when you have something on your plate that needs to be attended to. We forget how important it is about self-care. Self-care ends up getting very low on the list, and it might not have been very high on the list to start with. And then when we have so many other things we need to attend to, it gets pushed further and further away. But in fact, there's this adage about put your oxygen mask on first before you help the other person. The reason to do that is because you cannot be of much help if you yourself are depleted. And that's really true whether you're the caregiver or whether you're a professional caregiver or a family member, whether you're caring for yourself or you're caring for somebody else. Self-care, we make sure we have time. When the doctor says you need to be at this appointment at this time, we're there. But often when we make an appointment with ourselves, we push it off. It really doesn't keep things in balance. It's very important. And there are very simple exercises. We'll go over them. You can find them on the website to really care for yourself. But the first one, which is the easiest to do and doesn't take any time, is to acknowledge that you need to be cared for also. Just that can often bring up some no questioning. But to really sit with the importance of putting your oxygen mask on first, taking good care of yourself, that's step one.